Thanks, Councillor Corla. Sinn Féin will be supporting this bill. It is technical in nature and, let's be honest, it's not the most glamorous piece of legislation, but it is nonetheless extremely important, providing for, as it does, the amendment of certain provisions of the Health and Social Care Professionals Act 05 relating to the recognition of non-Irish professional qualifications. There have been many bills seeking to amend the Health and Social Care Professionals Act over the last number of months, and important changes have been made to that legislation regarding physical therapists and physiotherapists. And Minister, you outlined for us here the work done to date on bringing counsellors and psychotherapists in. And this is an issue that I have discussed with Minister Harris on a number of occasions, and it's one that's been well rehearsed in the media. But it does have relevance to the piece of legislation that we were discussing here last week, because until there is regulation of what are commonly known as rogue crisis pregnancy agencies, we will still have people purporting to call themselves counsellors and experts and every other thing that they do, telling women who access terminations that that abortion can lead to cancer. And that really needs to be addressed, and I absolutely welcome the fact that you have outlined the work that's been done to date. I want to assure you of the support of Sinn Féin in terms of anything that you will do to bring some regulation into this area, because in a couple of weeks' time, the hope is, not much the expectation, but the hope is that the heat will go out of the issue of just discussing abortion. We've been discussing it for a long time. But we want to see that, that's one of those sort of loops that needs to be closed. There's other things in relation to sex education in schools and stuff, but that is a very, very important one, and I absolutely welcome the work done to date. And as I say, I commit my party to working with you to ensure that that regulation is brought in. The core legislation that we're amending here is important, of course. The Act currently provides for the statutory regulation of 17 designated health and social care professions regulated by way of statutory protection of professional titles by confining their use solely to the persons granted that registration. The structure of the system of statutory regulation comprises registration boards, committee structure dealing with disciplinary matters, and a Health and Social Care Professionals Council with overall responsibility for the regulatory system. These bodies, collectively known as CORU, are responsible for protecting the public by regulating health and social care professionals here in this state. CORU was also charged with the promotion of high standards of professional conduct and professional education training and competence among the registrants. The bill at hand is short and technical, and it provides for all non-Irish professional qualifications which have been recognised by the Minister and by bodies acting on behalf of the state prior to the introduction of the statutory regulation for health and social care professional, and they will continue to be recognised for the purposes of registration under this Act. This will allow holders of such qualification to be statutorily registered and to practice their professions. The existing legislation does not allow for the registration of non-EU persons or persons with non-EEA qualifications whose qualifications have previously been recognised here. There is a gap to that extent, Minister, in the legislation, and this bill rectifies that. It's important that, as I said, mentioning other loose ends, it's important that we tie up these loose ends, because the social care professionals that are affected, they need security so that they can register, and the patients also need security in this regard. With regard to the regulatory bodies that we have, particularly in the area of health, we have CORU, we have the NMBI, and we have the Medical Council. And, Minister, I'm aware, for various reasons, of the functions, as you will be yourself, of the functions of all of these boards and councils, and etc. But I can tell you that among those health professionals who are registered with these boards, and I know the work that goes on as it goes. For a brief period, I represented the workers that were on board alternate, or some of them, so I know that the work that goes on in terms of research, in terms of regulation, in terms of educational support and provision. But I have to tell you, Minister, among the professionals who pay a fee every year to be registered, they very often feel, and if you check social media tonight, you will see a particular group, and that's not why I raised it, it was in my head to raise it anyway, but they feel that there's a very heavy emphasis on regulation, on fitness to practice inquiries, on the punitive end, and there's not so much of an emphasis on the support end. Now, we could stay here all day and we could talk about the fact, and I've said this, and you will profoundly disagree with me, I know, but I believe that your government and previous governments have made sure that the Irish Health Service is a very unattractive place for health and social care professionals to work in. This is not helped by the atmosphere that can be created by paying every month or paying every year into an organisation for which you see no real benefit. And I'm not saying that there isn't a benefit, I know that there is. I know that the men and women that work for these boards work hard, I know they do a lot of good work, but that's very often not seen by those professionals who are subject to the board. But what they do see, because they see it on the news, and again, we could rehearse all day whether or not they should be in public or in private, but they are in public, and they see on the news, they see their colleagues being brought up, and it's really, really tough. I had occasion, and not many, but I remember every single case that I ever took to one board alternate, because they were really, the toll that they took on the individuals was absolutely massive. And the colleagues of those individuals, many of whom were called to give evidence, and you know, they conduct their business with the authority of a court, and it's a very formal environment for people to have to go to, people who work hard. You know, errors happen in the main, well, perhaps I shouldn't say in the main, but errors do happen because of short staffing. That's not the fault of the people who turn up to work. The people who turn up to work are the ones that are there, you know. It's the fault of the HSE, it's the fault of the government, it's the fault of the fact that the health service is not an attractive place to work. But where there is short staffing and errors do occur, then you know, you have people who are worried constantly, and then they get to pay for the privilege of having a body. That regulation is extremely important. I absolutely back regulation. I think it is exceptionally important. But I think if we are here discussing those regulatory bodies, it would be remiss of me to say that, notwithstanding the good work that they do, they are not viewed as an ally or an asset to many healthcare professionals. They are actually viewed in a sort of a big brother way, because the good work that they do is rarely seen, but the public trials and the fitness to practice hearings and all of those, they are always seen, and they are the reputation that they have, and that is how they are known. And you know, a couple of years ago, the government put up the fees for, or the board actually put up the fees for nurses to register with on board alternate, and there was a campaign by the trade unions to try and have that reversed. But the same thing kept being said to me over and over again. Every workplace I went to, people say, well, why am I paying them? This place is short-staffed, and if there is an error, I'm going to have to go to sit in the office that I pay for to account for things that are not necessarily my fault, because people make complaints when errors happen. Errors happen for a whole variety of reasons, but nurse after nurse after nurse, a midwife after midwife, are coming to me and saying, why am I paying for this? I'm actually paying, I'm working hard to earn my money, to pay money to these people who are going to regulate me, that I could find myself in front of for something that I don't believe is genuinely may not be, strictly speaking, the fault of the individual, and could be down to the old systems error, could be down to short staff, and it could be down to any one of a number of reasons. So, Minister, as I said, Sinn Féin will be supporting this legislation, and we are actively looking forward to the legislation regulating counsellors and psychotherapists, but I would urge you to have some thought about maybe doing more to promote the good work that is done by these regulatory bodies, or indeed having a discussion with the regulatory bodies to, you know, to maybe bring home to them the reality of how they are viewed in their own communities, because I think sometimes that's not always evident, and it shouldn't necessarily be an adversarial relationship between the healthcare professional and the regulatory body, because there is an element of support and education that is there, and that's very often not seen by many of the people that are regulated. Go